There are many people who do not take their medicine as prescribed by their doctor. The result is that the effect of their treatment is reduced or absent. One of the consequences of this could be the patients becoming more ill and needing to seek emergency medical assistance and subsequent care. 10% of all admissions to hospital are due to poor compliance with medical treatment, which leads to increased costs for society, unnecessary suffering for the patient, and worry for relatives. 3 common reasons for poor compliance with medical treatment are forgetfulness, complex treatments, or a lack of communication between medical personnel and patients. We have the solution, our unique medical treatment solution, Medimi Smart. Today, healthcare personnel deal with the filling up of dosette boxes with tablets from bottles, boxes, etc. at the patient's home. This procedure can lead to stress, since many patients like to communicate with the healthcare personnel while they are in the patient's home. This can lead to errors in the actual filling up of the dosette box with the medication. In our solution, this task is attended to by a pharmaconomist at the pharmacy who ensures, by means of a filling machine, that our dispensers are always filled with only one preparation per dispenser and a label showing the PN number, preparation name, and an OCR scanning code that also contains the drug ID or article number is affixed. When the patient is at the doctor prescribes what type of medication the patient is to get. The doctor sends a prescription with, for example, type X via the e-medicine card FMK. The prescription now arrives at the pharmacy, which checks that the patient is given the cheapest preparation and then issues medicine Y. Medicine Y is packed into our dispensers we have developed in-house, and the dispensers are either sent out by courier to the patient or the patient picks up the dispensers at the pharmacy. The information about the prescribed medicine X and the medicine issued Y are both transferred via the e-medicine card to the municipality's care system. Changes to information on medicines from the e-medicine card are always approved by a nurse, who thereby quality assures that the medication information is correct. The medication information is then passed on to Medimi Smart. The medication schedule is then updated at the patient's home, and we have thereby ensured that the medication information is always identical at the patient's home and at the municipality. When it is time to take the medication, Medimi Smart begins to display a green light, and if the patient has not remembered or seen the green button, a reminder SMS text message will be sent, and the patient can now take his or her dose. But if the patient has still not taken his or her medication and the time window is almost past, the button gives off a red light, and then Medimi Smart can send an alarm to either the healthcare personnel or relatives who are able to phone the patient and remind the patient to take their medication before it is too late. Medimi Smart is located at the individual patient and is connected electronically to the care systems. We thereby ensure that the information on medications is always up to date. Our complete solution, Medimi Smart. A safe and easy system to help with medical treatment. A nice design that does not signal a medicine cabinet, but is more like a kitchen appliance. Information is available via the large, intuitive touch display. The dose is provided by simply clicking on one button when it is lit up in green or red. The patient can be reminded via SMS when it is time to take his or her medicine, and if the patient has not taken the medication within a certain time window, this will be logged and the information sent back to the care system to create an overview of compliance with the medication. There are 2 versions of Medimi Smart, with space for 12 different preparations, and larger version, XL, with space for 16 different preparations.